Hi everybody, welcome to our workshop today. My name is Shamsu Chowdhury. I manage the Bangladesh Mental Health Forum, and I have my colleague with us who's a chair, Dr. Shamsun Islam. She's also a clinical psychologist for North East London Foundation Trust and Redbridge Council. Today's workshop is on understanding the mental health in people with intellectual disability. Shamsun, do you want to introduce yourself a bit more, or should we move to the next slide?
Hi, welcome everyone. Thank you for joining us. Hopefully you'll get some insight into learning disabilities or intellectual disabilities. I'll go into more details as we go along. Like Shamsu said, I'm a clinical psychologist. I work in learning disabilities currently and in Redbridge, but I used to work in learning disabilities in Tower Hamlets as well many years ago. Anyway, but let's move on. So the purpose of today's workshop is to raise awareness about the mental health of people with intellectual disabilities, and we're really privileged to have so many people join us, and hopefully we can have some interactive discussions and look at these topics. So we will cover what is a learning disability, look at the historical view. It's just an overview, but it'll help understand how we are where we are, how learning disabilities develops, and the mental health of people with learning disabilities, and how and where we can get help. So hopefully that's all covered.
So just a bit from me before we start. So obviously it's important that you can keep your microphone on mute, please. If you wish to contribute to the discussions or have a question, you can just raise your hands or there's an icon, hands up icon on Zoom. Obviously, as Shamsun mentioned, that we would like this session to be interactive, so it'd be great if you can contribute and just say how you feel, and you just raise your hand whenever you want and just ask questions. If you experience any sound or video problems, try turning off your video stream. It helps. Just try turn off your camera and just leave in audio. It does help. As mentioned earlier, the workshop is recorded. If you wish to remain anonymous, switch off your video. We will put this video on YouTube, and I'll send you the link later on. You can see it yourself and share it. For the last 4 or 5 sessions we've recorded, it's been an amazing learning resource. Put it on YouTube. We've had like nearly over 90 views on one of them, so it's really good. It's really important that we have your email address, please, because I need to stay in touch with you and obviously tell you about future stuff that we do in terms of workshops and environment opportunities. So if you can kindly just email me, direct me, message me your email address, I really appreciate that. And lastly, obviously, please listen and respect. Obviously, if people say things and if you agree with those disagreements, just keep it to yourself. We're in a forum here, we need to respect. So yeah, so that's really the key information there. And also, just a bit about our organization, the Bangladesh Mental Health Forum. I'm sure people that have been here are probably a bit bored of this. But I've noticed a lot of new people here. So just a brief overview. We're a local mental health charity based in Tower Hamlets. We established in 1999 by Bangladeshi mental health professionals. Obviously, they saw a need that there was a need to raise awareness of mental health in the community and get more people involved in professional capacity in the mental health field. So that was the main reason for setting up the organization initially. So our key objectives are to raise awareness of mental health in the community, to get people talking about mental health, like challenging and overcoming stigma, to increase access to services from the Bangladeshi community and any other sort of migrant community where we're from in this borough that we work in, to signpost to local national services. The good thing about this online forum is that historically we're a Tower Hamlets-based charity. We've had, people that have actually, because of online presence, coming from all over the country, like Bristol, Southampton, Swansea. So this is even a great way for us to promote and get the message across to other communities have slight difficulties. So how do we do our work? We do lots of workshops in the community. Obviously, pre-COVID, we used to do workshops in schools, community centres, or whatnot. We organize group activities, like, well-being activities, like group sessions and whatnot. We do lots of events in the community, local events to raise awareness of mental health. We usually, when we do a big event on World Mental Health Day, we usually get over 200 or 300 people attending, which is really great. Local events, we get average of 60 to 100. So there's lots of interest in this and lots of interest in, learning about mental health. So that's great. We have some awareness materials that we've created. If you can go to our YouTube channel, we have lots of videos that we've made ourselves about, mental health and, how we can overcome mental health issues and how to access services, and just telling people about what mental health is. We've also created a leaflet called Let's Talk, which is actually getting reprinted at this right moment with new information. So I'll put that on the website and share with you. But hopefully in the next, when post-COVID, we plan to circulate this leaflet in GP practice in school. But if you want to use it as a resource from wherever you're from, please do let us know and we'll see if we can help you. But it will be on our website. For current activities, obviously we've done lots of stuff online. For the last 5-6 months, we've done about 15 workshops and we've had really good attendance. So thank you very much for attending and supporting us. We set up a one-to-one signposting information service where you can actually call us if you have any issues and we can refer you to the right service. So you can speak to somebody in Bengali. So this was one of the key issues that we found when we do community engagement work, that people find it difficult to access services and get support from, in the appropriate language. So we felt appropriate that we set the service up. It's very on an ad hoc basis at this right moment. Hopefully we can support people on an ongoing basis in the future, pending funding. But yeah, so anybody in the country can call us at this right moment. We're happy to speak to anybody from the Bangladeshi community. And we've also set up a well-being group called the Let's Talk Forum. It's a women's only group. It's been very proactive. They've had about 10, 12 members. They've had 2 meetings already. We've closed that group because we want it to be a small group, but it should reopen again, hopefully in the next 8 weeks. So if you're interested in joining, please do let me know. So that's just about us as an organization. I'm going to pass you on to Shamsinafa. But before I do, this is all my details here. If you want to take a picture, but I will share with you details. We have a YouTube channel with all our videos, great resource there. We're on Twitter and Facebook. Yeah, please, share, like us, and follow us. That'd be really good. Thank you very much. Shamsinafa, it's up to you. Thank you now.
As we start, I know we advertise this as a Bengali presentation. Can I just have some sort of indication, if you could raise your hands or something, on how many people want the Bengali version? Do I need to sort of do both, or are we okay to carry on with English? Just an idea? Okay with both. Okay. Obviously that's more time. I think English. Okay.
Yeah.
Okay, so there's a greater demand for English. Let's do it in English, and if there is if someone needs me to explain it in Bengali, I will happily do that. So to start off with, can anyone tell me what do you know about or learning disability or intellectual disability? What is it? I've added a little picture because I like pictures, but it's a quite a poignant quote and something to reflect on. What Albert Einstein said, that everybody is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing it's stupid. And that says a lot about society and how we look at people with disability. So I'm sorry, I can't see the chat, Shamsu. Do you think there's any response to my questions? Oh no.
Yeah, okay. So I just don't want to put this black box on the video screen.
Okay, yeah, no, I'm checking
what I'll do, I'll have a look at the other, I'm on another screen as well.
No, it's okay, I'll have it on the side.
Yeah. I'm on the chat now, that's fine. Somebody's mentioning it, we're doing Bengali as well for recording, passing on to others. I think what we can do, I think let's do this one in Bengali, and what we can do is another one. Sorry, in English. Sorry, in English. And in
Yeah,
the future, we'll do another one in Bengali. Hopefully next month.
I
Is that
think
all
so.
right, Shamsina?
I think that would be fine.
Yeah.
Okay, so we're already running out of time. So let's move on to the next slide, please.
So before you go, Shamsina, because I've never heard of this term intellectual disability. What is it? Are you going to be explaining today?
Of course, of course. So that would be a bit pointless if I don't. Yes, so interchangeably, learning disabilities and intellectual disabilities is the same thing. We use it interchangeably. So what's happened in the manuals, they've moved on from learning disability to intellectual disabilities. So in academic circumstances, we use more intellectual disabilities, whereas in everyday language, it's learning disabilities. However, there's more complexities to that. It's not as straightforward as that. There's a different, the terminology gets mixed up. So in education, we use interchangeably learning difficulties and learning disabilities. So I'll go into detail with that a bit later. So let's just first think about what is intelligence. I don't think many people spend much time thinking about what intelligence is, yet it is a common word and we use it all the time. From a psychological perspective, if we're thinking biologically, so everyone, we are limited to our genetics in how much we are capable of achieving in life in terms of functioning and how much our brain is able to cope. So there is a biological factor to that. So not everyone is on the same level when it comes to measuring biologically. Yes, we all have brains, but different capacities within that, and our genetic makeup will have an influence in that. On the other side, we've got the social intelligence, what we call social intelligence, which is more environmental, which comes from our interactions. You may have heard people sort of use words like streetwise. So someone is streetwise, meaning that they're able to look out for danger, they're able to keep themselves safe, they are able to make a journey out in the environment. So those kind of specific behaviors that we have, it is context related. So it's all about the culture, the context, what kind of exposure we've had, and what we've learnt from that. So that's another measure of intelligence. So it's not an easy thing. It's not just academic. It's not, intelligence is quite varied, and we can look at it. Someone could be quite smart or intelligent in using IT. That doesn't necessarily mean their intelligence is very high. It means they are very good at IT. So what psychologists do, basically we try and measure both these components in an observable way. So we look at what is allowed within the biology of someone and how it's influenced by the context and the culture that they're in, and after doing these standardized tests, we come up with an IQ measure. So IQ stands for intellectual quotient, which is a scale that we use. It is quite an arbitrary scale, but that is what has been used over the years, and we use it as a measure, but not the only measure, and that's a key thing. It's how someone would perform on specific tests if they had grown up in these circumstances. So these tests are not something that we can use in every culture. So the test I may use with a child in the UK who's in the schooling system, it's not going to work effectively if I'm using with a child who's just come from Africa, from any country in Africa or Asia. because it's a different context, it's a different culture, and those tests are not measuring those things. So that is how we look at intelligence. It is not one item, it's several things that cover biological components to it, social component to it, and we're trying to measure. Moving on. What happens when, because there's different types of intelligence, and I would say in everyday language, it's the ability to reason abstractly. So things are not actually in front of us, but we can think about in an abstract form, solve complex problems, and the ability to acquire new knowledge. So that's a psychologist's definition of intelligence, and it's a very broad spectrum. But the question starts when these abilities are delayed or are not happening for someone. So that's when we get to intellectual disabilities. When the brain hasn't formed to its complete full potential, that's when we see disabilities. And there's thousands of disabilities that we can't see. Just by looking at someone, you wouldn't know whether they've got a learning disability or not. But obviously, as society, we need to be treating people fairly and equally, and it is a big issue that is quite hidden, and it's been hidden in society for many years, centuries probably. Moving on. So this is the definition for intellectual disability. So currently this is the new buzzword that we're using. It is how we're defining it, intellectual disabilities, because of the probably more of the confusion it happens with learning difficulties and learning disabilities. So intellectual disability is a disability characterized by significant limitations in both what we spoke about, the intellectual functioning and the adaptive behavior. So I'll go into those, and this covers the everyday social and practical skills that someone needs to have. And this disability has to get the diagnosis, it has to start at before the age of 18. So usually in childhood. And in it, just a bit of statistics, it's always nice to sort of have some figures there, but to think, if we think about a child's brain development, 90% of it is happening, it's happened by the age of 5. The rest of it is the frontal cortex, which is happening much later on in life, but it's only 10%. So we don't actually sort of think about the significance of children's brain development in that 0 to 5 is crucial timing for their development in so many different areas of intellectual functioning. The thinking, the learning, the reasoning, the problem solving, all of this stuff is essential at that age. But for some people, it doesn't happen for a number of reasons. And I will cover some of those later. Next slide.
It seems like Shamsinafa, it's frozen. Let's give her a few seconds. I'm sure she'll be back. Unfortunately, it's one of those things when you're doing online. I'm gonna just, oh, goodness. Okay, she's gonna rejoin. We can't hear you. You're on mute.
I'm on mute. Yeah, I lost connection.
Yeah,
Sorry. So adaptive functioning, which is looking at the practical skills, the social skills, the conceptual skills that someone would have. So every individual, as an individual, we're able to use language, reading, writing, maths, doing any problem solving. Those kind of concepts come under conceptual. The ability to socialize, to communicate with people, to learn body language, to be able to understand how to make friends and how to keep friends, that would be categorized under the social functioning. And practical is more the everyday things that we do: cooking, cleaning, looking after ourselves, changing, shopping, managing money, buying a house. Those are all practical things. So someone's functioning has to be stunted in these areas as well to then have the diagnosis of learning disabilities. So you've got the intelligence. There's a limitation in the intelligence, and there's a limitation in the adaptive functioning.
Goodness me.
Oh no! Have I gone? Have I
You're
frozen
back.
again?
You're back now. It's okay. You're back.
It's so windy, and I'm in this room where. Okay, never mind. Move on. Next slide. I should. Yeah, you're recording this, so I need to be careful not to swear.
Yeah.
Okay, so throughout history, there has been different labels have been used. So for different legal reasons and for medical definitions. So, and different cultures have different ways of understanding learning disabilities. So if we just stick to UK and think about how things have developed over here, it has taken a long time to get things to where we are at now. Often the labels have been derogatory, and people have been sort of faced with a lot of hostility. What used to happen in this country up until the 80s, people were sent to institutions and away from public view. So in some ways, if you weren't a functioning person, you didn't have a job, you couldn't do anything, you couldn't manage in school, things like that, you had a disability, any form of disability, whether visual, whether you could see or not. Someone has just said a lot of ignorance exists. Absolutely. We are, in some ways we've advanced, but the discriminations that we see still exist, and it is quite difficult. So to get people to accept this, knowledge is very much required. As a society, we need to think about how people are treated and how we as members of the society, how we're looking after the vulnerable. And it wasn't, people with learning disabilities weren't viewed as vulnerable. They were just viewed as a nuisance in society. These are the people that are not good. You're not making any money, so send them away. This is the kind of years ago the eugenics movement happened because of this. Because if you're not an active member of society, you're not someone who's contributing to society, let's eliminate those people. So Hitler came up with these ideas because of such movements. People that are not useful to us, we just want to kill them off. So that was the idea where eugenics sort of started off. And when that stopped, but we have these views, people have some strong views about who should be included and who shouldn't be included in society. But yeah, that's another discussion. So another thing that happened is that either what people with learning disability just didn't get any access to services, or very limited. It's only probably in the last 30 years or even less that they were included in psychotherapy, any kind of therapy, in mental health services. It wasn't even deemed important, because if they don't understand, what's the point of, it's a waste of money. Or people went the other way. There were, and that still happens. A lot of it happens in our Bangladeshi community, not just Bangladeshi community, actually, in the whole South Asian subcontinent. There's a lot of overprotection, but oh, that person won't be able to do it, so I'll do it for them. And there isn't any risk taking, or there isn't that learning and teaching that happens, which actually, just because they have a disability doesn't mean that they cannot learn or advance in some ways. There might be a limit to how much they can do, but to get to their potential is not something that's sought out much. And it's actually how society looks at someone, and that's how we sort of make someone disabled. These are social constructs. Yeah, we made it up, we use it, we give them strength or we don't give them strength. We're the ones who are marginalizing this community. So it's often society that disables people by marginalizing them and focusing on what they can't do instead of their strengths. So not everyone is not everyone is open to these ideas, open to embracing and learning and helping others, and which is a problem. Hence, government legislation and policies have to come into place. So we will find, and you'll learn by the end of this session, that actually people with learning disabilities, we have more in common than difference. But it's how we as individuals think about it, and we're the ones that could make the change. Next slide, please.
There's lots of comments on the chat.
Okay, yeah, come on, let's engage.
It says still a lot of ignorance exists, lack of knowledge. Yasmin said there is stigma and denial in communities of SEN. Services pass the buck around.
Absolutely.
Special education kids are gifts for families and amazing beings, if only they are given the support from both family, education, society.
Of course, and that's what I'm saying, that you know there's a lot to give, as human beings, as individuals. There's we all have our strengths and weaknesses. We all have things that we're really good at, things that we don't struggle with, or don't want to do, and there'll be certain limitations. Our biology is going to stop us from doing certain things. Now, if I was to turn around and say I would become Usain Bolt, well, that's not going to happen. It's never going to happen. I don't like moving much, so my biology is going to stop me. There are limitations, and we all have that. So if we all have that and we're all individuals, then why put people in these boxes and treat them differently? What's in the name? Sorry.
Yeah, I feel saying there's a lack of knowledge and understanding, poor standards of communication, delays in diagnosis and treatment, isolation, lack of support, and high levels of care stress.
Absolutely, I agree. It is something that has to be worked on. Back to the slides. What's in the name? So you could just see how society has changed and how things have evolved. So people with learning disabilities they used to be called, actually referred to in government documents. You have them referred to as idiots, morons. This is where those swear words come from. Feeble-minded, mentally retarded. I know when you hear these words, it's like, oh, it's so uncomfortable. How can you actually? But you'd have, up until June 2018. Yeah, so 3 years ago, not even that. You'd have psychiatric reports which had the diagnosis of mental retardation. It's horrifying, but that's how we referred to individuals. Then came learning disabilities, and intellectual disabilities came in more in the research forum, etc. But now in the latest manual for diagnostic, the Bible that psychiatrists use around the world, it is referred to as intellectual developmental disability. So over the period of time, as people and society are changing, people are becoming more aware. The name has also been changed, and it hasn't changed who falls under that group. It's still the same group of people, but we've had different names. So those names are changed into, they're used interchangeably. The sticky one is learning disability and learning difficulties, but I think I go into that in detail a bit later. Next slide, please. Have I frozen again? Okay, so diagnosis. As I said before, in the UK and America, it's those three components that we need. All three criteria must be met to get a diagnosis of learning disabilities, and to do that, it would actually be a psychiatrist, psychologist. It probably would be someone who's specializing in that area. Or I mean, like schools and teachers do that, but again, that has to be sort of proven in some ways. Like you have to show where that impairment happened, how the assessment was done, what kind of functioning they're doing. So it needs to be assessed, and then the diagnosis is given. If it's not given at childhood, then you have a lot of problems in adulthood. But yeah, we'll talk about that. Next slide, please. Oh, you're frozen again.
No, you're fine.
Okay, so next slide.
We're on the slide.
Okay, so the examples of, so once we categorize people in this group, there are subgroups to that. So looking at the intellectual functioning, here are some like everyday examples of what people with learning disability would not be able to do. So they won't be able to read and write well, not able to drive, not passing exams at schools or college. So they might be doing entry level 1, 2, something like that, or life skills, but they're not able to pass the standardized exams like GCSEs, not be able to hold down a job. Not to say that, I have found in my experience that there isn't a lot of jobs available. So in the olden days, you'd have factory workers or laundry workers where people can go and do the same old repetitive job. These days, those manual works are not available. Everyone who's working, even if you're a porter, you've got to do a lot of admin-y stuff, lots of writing, reading, and which makes the job really difficult. There are some organizations, very few, who actually offer people with learning disabilities jobs. So that's something that we've got in society. And difficulty in solving problems and reasoning. So just those executive functions are really difficult for someone with the intellectual problems. And the assessment, the IQ that is being used, it's still being used. It's I think there is a slide. I think the next slide will explain. Go. Yeah, so I don't know how many of you are familiar with the bell curve, but this is something that a measure. So most people fall into in that green section. So in society, if we were to measure 100 people, most people would fall within that green section. Some people will fall in those blue sections. So either side, one lot of people would be quite bright, and the other side is like, no, they're struggling, they're below average. So the people in the green are generally seen as average population, you, me, everyone. Yeah, people who are able to do their everyday things. Then you've got the pink section. So on the one side, you've got the gifted. So people with high IQ, people like the Einsteins of the world, they're on that end. Yeah. Whereas people with learning disabilities fall below that 70. So the other end of the pink. So you can see how much, in percentage wise, it is actually a very small percentage of people that in society that are affected by learning disabilities, whereas a great majority are falling in the green and are functioning. Hope that makes sense. Ask me questions if you need some clarifications. But that's how intelligence is measured, and you kind of sort of find the IQ scores of everyone sort of fitting in somewhere. Average is 100, so most people are 100 or around that time, within 85 and 115. So the maths people here would know about standard deviations, etc. But without going into too much technicality, most people are in the green. The population that have learning disability are actually the pink area on the left. Yeah, so below 70. And that marker itself has also changed over the years. Initially, it used to be 85, and then over the years, it reduced to 75 and below. Now it's 70 and below. There are some people who'd be even further down, but they would be there'd be significant, profound disabilities there. So they are very much a small population. Next slide.
Sorry, Alpha, before we move on, just one quick question. Somebody's asking Shippa. She's asking, what happens when signs are visible towards end of childhood and into adulthood? What help is available then? Would you?
What help is available? Well, help, it depends on what the diagnosis is, whether the signs would be, for people with learning disabilities, the signs would be apparent earlier. So you wouldn't be able to go through school and not being picked up. Yeah, so I think there is something that I'd sort of talk about. Can you get IQ test on the NHS or privately? IQ test on its own, like I said, there's problems. So perfectly timed question. There's problems with just using IQ for diagnosis. Yeah, because it's an arbitrary number. It's a number that statisticians have come up with. So between 61 and 72, the cutoff was below 85. Yeah, this was then changed later, and now it's less than 70. So lots of people that were in that group from 70 to 85 who still struggle, but they don't have any services. They don't get this specialist service, and it's mainly because the services themselves have been slashed so much. So government funding's not there. There's not a lot of people doing that work to serve that population, so things have moved that way. We have people that are just above 70. What does that mean? Suddenly that because they've scored something higher that they can manage, they can't. They still have those problems. So going on an IQ score alone, I don't think nationally we don't have any service anymore where IQ is the only thing used for a diagnosis. We can't. You need to have that intellectually a deficit there, and also a deficit in the adaptive functioning. So if someone could still function in the world, then they don't necessarily have learning disabilities. So there's lots of complexities. I don't think it's straightforward. You can't just go to the NHS and want it and get it. And you definitely won't get it in private. You could have someone tested in private, but that doesn't make them clinically learning disabled, if you know what I mean. Yeah, there's complexities. So that's one of the reasons why we don't use IQ alone. It's just an indicator of functioning. So something psychologists can do, someone has done those tests and it shows that they're not able to do those kind of mental understanding those mental arithmetics, or their perceptual reasoning, their verbal reasoning, all those things are not quite there with their peers. Next slide. Have I lost you?
No, hold on.
Okay, okay. Yeah, that's
it's
fine.
a bit slow. I think that now you're in the right slide.
Yeah. So the adaptive functioning side of things, so they both have to come together. It's hard for parents to find the path for diagnosis schools nowadays. It's absolutely, I agree. And if you don't know this, then it's even harder, because you don't even know, you're relying on agencies that you're interacting with, like schools, to give you that information. And it all boils down to money. So who's going to fork out for these? So it's a sad situation, but that's where we are with social services and the NHS. So impairment of adaptive and social functioning. So everyday examples would be struggling to cook and clean, difficulty using transport on their own, not remembering things, problem keeping or making friends, difficulties on judgments of others. So not really sort of understanding what someone else's intention was in a situation. So they're not able to pick up the social skills, the cues, not able to assess the danger in situations. So they can't really look after their own safety. There's lots of people who with learning disability are able to access social media and things like that, but they're not able to protect themselves. They don't sort of see the risks of grooming, this and that, or yeah. So those kind of problems arise. Also difficulties with money, so they might not understand the value of money, or what change they're going to give, or roughly have an idea of how much things cost. They won't be able to manage their finances, like pay their bills and think about organize things that way so that they can manage their finances. People with learning disabilities have huge struggles there. And organizing themselves, like if they've got appointments and times, some of them don't know the days and times and can't read the clock and things like that. So we are talking about a group of people who are really struggling in their functioning, and many a times what happens is that families help them out. So throughout life, their parents or siblings have been addressing all their needs. And I think we get to a breakdown when the parents are too old and they can't manage, and then the problems arise because there's not someone else helping this person out. And I know in some societies it's much easier, would, especially in the Bengali society, like there's lots of I know that there's lots of stereotypical roles that we sort of fall into. It's only the women that do the cooking, and the men don't know how to cook or clean properly. Yeah, I'm just using an example. I'm not saying every man is men are like that, but as a culture, when it's not something that's encouraged. If a little boy is playing with toys, resembles, making cups of tea and stuff, people get uncomfortable. Why are you playing these sissy games and things like that? That's how society sees that. So if someone it doesn't mean every man, because he can't cook or clean, it has got learning disability. It means that they also haven't had that experience. So they haven't, yeah, like, women might not do certain jobs. It doesn't mean that the woman can't do it. It just means that she hasn't probably had the experience to do it, or the will to do it, or etc. But that doesn't necessarily mean that you can't do it. With people with learning disabilities, they just don't have the skills. They won't be able to manage the cooker, the heat, the recipes, etc. It's just not, they don't have that capacity. Some people do actually learn lots of skills in cooking. They can make simple meals, but with the right help, with support, so we can all achieve a lot more than what we can do on our own. Okay, and the last bit is it has to be before the age of 18. I think that's the next slide, Shamsa. So, and it has to be before adulthood, because there is a delay in their development. So children's development is from 0 to 18. Actually, brain development goes on till 25. But yeah, we've got this number of thinking that children reach adulthood. This is a legal term, more that, at the age of 18, but most of their development has happened by that time. And one of the common, some of the common indicators would be learning to walk or talk. It's much later than the other children. So, funny, we should, when I was doing these slides, I asked my husband whether he knows how old our children were when they started walking and talking. You won't believe it, but this, he's he hasn't got a learning disability. He's just not aware because he wasn't around and he didn't pay attention. But it's just not in his schema to think about when do children pick up those skills. So usually mom would say, yeah, it's about the same time, but actually it's not. It can be a delay. Generally, children start walking around 1 year and they start talking around 2. But most people don't even have that in their mind. You can't. Yeah, so you don't know that. But yes, people with children usually do, except for my husband. But yeah, delay in toilet training. That's something that could be a difficult thing. Some people could go on even to adulthood, so they just won't be able to manage that skill. And if they're going to mainstream school, they will need a lot of support, if that is available in mainstream school. There are some special needs school around, probably in most boroughs there's 1 or 2. We've got in Tower Hamlets, we've got the Stephen Hawking School for the young ones, primary school, and then we've got Beatrice Tate. We also have Phoenix School, which is for people with autism, but it's people with autism with other difficulties, so that they take from children from young all the way to college. And a statement of special education needs. So what used to be, we used to refer to them as like, this child is statemented. So that means they've got special provisions from the local authority saying that they've got educational needs and they need some extra help. Nowadays, not everyone with special needs statement, not everyone who's got one means that they've got a learning disability. They might have learning difficulties. So, and they haven't reached, they haven't sort of had any qualifications, etc. But there'll be many reasons why people can't meet those criteria, but doesn't mean that they've got a learning disabilities, like my husband. But yeah, potential causes of difficulties. I'm like that. There's sometimes you could have these difficulties have come about because after the age of adulthood, after the age of 18, someone may have been involved in a road traffic accident, where they've had brain injury, or have a brain tumor or have mental health difficulty. So all those other things can impact on your life, like if there's alcohol or any other drug abuse and things like that, your functioning can be reduced, but it doesn't mean that you've got learning disabilities because it happened in, so we need that historical information, and the three parts have to come together for you to sort of be given the diagnosis of learning disabilities. Next slide. Okay, now's the interesting part. So lots of people will hear about learning disability falls under the umbrella of learning. Well, people would use it interchangeably: learning difficulties, learning disabilities. It's not. It's actually quite different. One is a difficulty that can be helped and people can overcome. So with strategies, you can get there. One is the development of the brain itself has stopped. So no matter how much you put in, there is a limit to how much they can achieve. So the other group, the ones with learning difficulties, fall under the umbrella of neurodiversity. So neurologically, we're all wired in a different way. So things like dyslexia, dyscalculia, dyspraxia, autism, ADHD, ADD, all of those conditions, it just means that their neurological wiring is slightly different. So they learn in a different way. So like someone can still, I've got dyslexia, but I'm also a doctor. Didn't mean that it stopped me achieving. It means I need extra time. When I'm doing something, I need extra time. I have difficulty with my reading. I need to read something over and over and over before I get it. Those kind of stuff. So that's neurodiversity. So lots of people will fall. There's a much larger, the bell curve I was showing you earlier. There's a bigger group of people who are in that green zone who have these neurodiverse conditions, and that is another topic that we'll need to cover another time, because I know things like autism spectrum disorder is a huge one in our community that needs to be educated and people need to understand. But that is actually the same type. So autism and dyslexia, it actually falls on the same umbrella, because it's the way the wiring has happened in your brain, the way your neurons have been firing. It's just a different makeup. Doesn't necessarily mean you've got learning disability. However, you can have learning disability and have several of these conditions as well. So yeah, that's the complexity of it. So your brain has stopped developing and you've got all of these. So does it make sense, Shamsu? Because I know you and I were struggling to get this bit across. Are you frozen? No, I can hear you.
Yeah, it's making.
Yeah, so neurodivergent it means that neurologically we're diverse. It's like when we think about race, people of different colors, different ethnicity, we're all the same, but we just have different pigmentation in our skin. So brain-wise, we're all the same, but we've got different wiring. So we learn in a different way. Some people need more help, some people need different help, some people need, so there's lots of things that cover in that under that neurodivergent umbrella. But this is what schools do. So schools identify, don't want to label people, so they will use learning difficulties even when someone has got a learning intellectual disability. Yeah, so that makes it really problematic when they get to adulthood and they want to get services, because most of the services, the statutory services, will only take someone on if they've got the actual diagnosis of learning disability. So yeah, if there's teachers out there, please make that diagnosis, put that in someone's report. If someone is, meeting those criteria, I think the knowledge of neurodiversity is something that needs to be sort of out there a lot more, and maybe someday in the future we can sort of explain a little bit more of. Absolutely, it's not straightforward, and it may be because I've got the luxury of working in this field, and I've got my passion is in autism and learning disabilities. I can talk this day in, day out, but it's difficult. There's money involved, so teachers are stuck in how they can define this. It then means they have to spend, local authority then means they have to spend, etc., etc. Okay, moving on. Okay, so what learning disability is not. So I've just touched on the learning difficulties. So people may have learning difficulty in specific areas, and which is not global. So not every area of their lives. Difficulties are not severe as learning disabilities. So IQ would be over 70. They say it's an estimated 16% of the population are illiterate. I can't do numbers, but far greater than 2% of the population with LD. So, so learning difficulties is not learning disability. Dyslexia is not learning disability. It is a difficulty in reading or writing. Dyspraxia is a difficulty in coordination. So people with dyspraxia would have difficulty doing their laces, organizing things, doing sports. ASD or autism spectrum disorder, now that's a big area itself, and that's difficulties in social interaction, communication. The interest is quite restricted, and they have a repetitive pattern in their behavior. So that again doesn't mean they've got learning disabilities, although lots of people with learning disabilities do also have autism. If someone has, like I was saying before, if someone had a brain injury after the age of 18, they will have those difficulties that we've mentioned before, like their cognitive functioning would be impaired, but that would be because the brain was affected by an accident or a condition, etc. Dementia. So lots of people get dementia and their cognitive functioning. By cognitive functioning, I mean their thinking skills, their reasoning skills. That is on a decline, but that doesn't make them learning disabilities. ADHD or ADD, those are also difficulties in attention and hyperactivity, impulsivity, but that's not learning disabilities. And people with learning disabilities can have some of these or several of these other conditions as well. Next slide. How are we doing for time?
So we came on 5 past. How many slides do you have left?
I've got no idea. I can talk all day on learning disabilities.
You got quite a bit.
Okay. No, it's okay. Not that much. I'll cover. These are important ones. I think so. What causes learning disabilities? So there's lots of biological and environmental causes that's going to happen. So biologically, someone, before they were born, prenatally, they could have genetic conditions like Down syndrome, Fragile X. That usually also means that they've got learning disabilities or will have learning disabilities. Other syndromes like spina bifida or cerebral palsy does have a lot of interaction. This is all happening pre-birth. Environmental reasons, like if the mum is malnutrition or substance abuse, then drug or alcohol or both, that could affect the unborn child with learning disabilities. You also have during perinatal, so at the time of birth, there's medical factors that could happen, like if infections of the wombs or some sort of complications during birth, so oxygen deprivation, that kind of stuff, if that happens, then that could also affect the way the baby's brain develops. So if the baby was deprived of oxygen or something, that's all that could happen. And postnatally also, so sometimes there's children who have developed in their childhood, they may have developed certain conditions like epilepsy or meningitis or Rett syndrome. So that could be biologically something's happened to them, and environmentally, someone could have a head injury as a child, accident, malnutrition, all sorts of other things can happen. If it happens before they're 18, they would fall into that group. Hope that makes sense.
That's right.
Okay, next one. So there's different categories of learning disabilities. So I'll start on this end with the profound and multiple disabilities. So this is a group of people who usually would have really severe disabilities in their visual abilities, their hearing, their movement may be impaired. They might also have autism and epilepsy, but they might need help with their mobility, wheelchair. Some could be just bedbound. There's complex needs. Maybe they need some, their food and communication. All of those are impaired in a way that they would need extra support, probably 24-hour support, and they will need support with their behavior. So although they've got all these other complexities, they also have behaviors, and we need to understand like what behaviors sometimes can be very challenging. So they're not verbal, they're making noise, they're upset, they might be hitting themselves if they can move. So that's like the profound and multiple disabilities. We don't see many of these people in society because they are bedbound or wheelchair or something, so they're quite hidden. Then we've got the severe group who may have a few words and gestures to help with their communication, but again, they will need a lot of care and support, support with their personal cares, they might also have lots of other medical issues, mobility issues and things. So, you can sort of just see the seriousness of each group. Then we've got the moderate group. So this group of people with learning disabilities, they may have some language skills and able to communicate, but there might be difficulties in their actual understanding, and they'll need some support from others to manage. So they might be able to do their cooking and cleaning, but they can't manage the money and things like that. And so, yeah, they need some help with their day-to-day task. Then you've got the people in the mild group. So that would be the group, in between 65 and say 80, that's that group of people who could be mild, but because of depending on their experience and their abilities, they can have some complexities, but usually they're able to speak, they could hold a conversation, but sometimes you'll get that they could even read books and things, but the comprehension's not there, or they might have the writing skills, but it's not, something's not quite, they're struggling on certain areas. So people with mild learning disabilities are the group of people that actually are less served. So certain boroughs actually don't even cater for this group of people, and I personally think this is the larger group of people that need help, because they might be able to do certain things, but they're not able to do the finances. They're not able to, budget their benefits and things like that, and that's how they fall into debt and prison and forensics, and it just gets really bad for them. But they just need that support, but we don't have it. previously you used to have lots of organizations which did a lot more help for people, voluntary organization, even the Citizens Advice Bureau, like that's whittled down to nothing, I think. But it's like places like Newham, they don't see people with mild learning disability. So in Newham, if you live in Newham, it's only moderate. So people who have got much more higher needs will fall in the learning disability group. There isn't a service for the mild group. Yeah, so that there's lots of complexities, and I think it's much harder for people in the mild because they're just not being able to sort of bridge that gap. So things that are the person is not likely to have learned. So if someone, generally speaking, if someone is able to drive a car, so there's lots of complex cognitive functioning that your brain is doing when you're driving a car. Yeah, so all those complexities is not something that someone with learning disabilities could manage. So that's a good indicator of like, no, they don't have learning disability. They've achieved some sort of mainstream qualifications in school, GCSEs, O levels, with some support. With or without support, they've managed to get that. They're able to buy, like lots of people would struggle to buy a house and things like that. But if given the information, they'll be able to do that. So that that's not learning disabilities. Or we've covered like brain injury several times. Yeah, people with brain injuries, if they've got a recorded IQ ever in their life, so as a child or whatever, they've been diagnosed with an IQ above 70, they're not going to get that service. And most of the services are needs-led. So if there's a need, that's when they come in. Yeah, so if they're engaging with mainstream services like talking therapies or social services, then they're not learning disability. Or if they've got paid jobs, and that's a big one, if they've got paid jobs, things that may indicate that someone's got learning disabilities is a record of delayed developmental difficulties. So if they've got in their everyday living, if they've got some deficits there that was there from an early age, though this person never actually quite got to this. Significant substance, no, they need help with their eating, drinking, self-care, clothing, all of that means that maybe they have learning disability. And all those three criteria, that cognitive functioning, that adaptive and social functioning, and it has to start off before the age of 18. There's other reasons why difficulty that people may have, but they might fall under other labels like autism and things like that. And they have contact with learning disabilities team. So every borough does have a service, a secondary care service, which has a learning disabilities team, which will have social cares, so social workers, as well as health people, so psychiatrists, psychologists, physios, OTs, nurses. So every borough in this country has one of those. And if someone's known to them, then they don't really have, then they have got learning disabilities. Okay. So I had a little video clip, but I don't think we've got time to watch that. But you can watch it. Can we?
Huh? I'll try. It's 2 minutes. It's fine.
Yeah, it is very short, but I think it's good to.
It's not working.
Okay, leave it. Let's move on because we've got to cover mental health.
Means that we may need extra support to
do
some every.
I can hear it.
Can you hear it?
Yeah. Now you've frozen.
No, I'm not frozen. It's just it was.
Okay.
I don't think it's embedded the
Okay,
right
so
way.
let's just go back to the slides.
Yeah.
Oh, this is
What can you see? Where are we at?
we are further down, further down. We're just before mental health, 25, 26.
Yeah. Here, we're here.
Yeah.
Yep.
So yeah, hopefully you can there's lots of actually videos on YouTube about learning disabilities. It's difficult to fully understand unless you're going through it and have to deal with this. Absolutely. You have to, if you know of someone, then suddenly your awareness happens. There are people who go through life and not even considered or thought about learning disabilities ever, or the people that might be in that group. So the physical health, so someone with learning disabilities may also have like other physical health issues. So although it's not an illness or a disease, but people have a greater risk of having physical and mental health conditions, and they do need treatment and care. And also the nature of learning disabilities, it's often more difficult to access services. So yes, you need to sort of have that label first, but even then it's still difficult to get the right health and social care education benefits. I'm like, with this COVID, so many of my clients have had their freedom pass taken away, and it's just crazy. But every couple of years, you have people struggling with their travel, their freedom pass goes. Universal credit, that's another bane of my existence. But it's so difficult for people with learning disabilities, because if they don't have someone who's going to advocate for them, how are they going to get these services? People with learning disability have a shorter life expectancies, a difference of 13 years in men and 20 years in women. Can you imagine how what that looks like from other people in society? And it's because they haven't had the right care and support. 4 times more likely to die of preventable causes than general population. So when they go to a hospital, they're not given the right treatment. I'm sorry, but it's still happening. It's still happening. We have people, gone to hospital, and even though it's in their records and things, they need supervision when they're eating, they've died from choking. Things that could have been prevented. People in homes and in institution, treated so poorly. I mean, some of you may have watched the Panorama program, I think a few years back, but there was previously another program which looked at a organization called Winterbourne, and from that, secretly, reporters went in and recorded the treatment of how carers were abusing people with learning disabilities, and that brought about a change in policies and laws. But yeah, I think I've gone off on a tangent. But back to physical health, yeah, they're more susceptible to having physical problems. Huge, I think the number one cause of death in learning disabilities is constipation. So because they can't tell you they're having difficulties, someone can be in dire pain, which then sort of triggers something else happening. But constipation, I'm like, that is easily sorted, but it's still the greatest killer for people with learning disabilities. Okay, next you've got Dawood Marsh
Just let him in. It's fine.
Okay. Next slide. So mental health also.
Yeah.
Okay, so there's a high prevalence of people having mental health difficulties in the learning disabilities population. And many times their mental health difficulties can be missed because people overlook that. You know, oh, they don't get it, they're not understanding or whatever. But they are equally, you know, they're human beings who also have difficulties, the similar difficulties that you and I have. So, you know, but the difference is that they're not able to communicate that, their difficulties, their distress, or, you know, other people are dismissing their needs. And it could also be presented slightly differently. So there's reasons why this happens, you know, why people with learning disabilities and mental health difficulties, you know, why it's missed. Next. So lots of people with learning disabilities experience these horrible experiences which are common to them. Bullying happens a lot. I would think, like, children are the cruelest beings. It's horrible when someone has had this all their life, you know, that you could imagine the trauma that they've gone through, and continuously, and it doesn't stop from school. You know, if they then go on to work environment, you know, it's still happening there. They've experienced a lot of trauma in their lives, lack of meaningful activity, so they're not doing anything, you know, of any importance. We all need to have some purpose. But their activities may be just sitting in a room, you know, just left there. There used to be organizations where, you know, people would be taken out for activities, you know, maybe even involved in sports and stuff, but that's really, I mean, like, they're going, if they haven't gone already. Poverty is a common experience, as well as people with learning disabilities very rarely are able to keep their children. So the children are removed because they won't be able to parent properly. But actually research has shown that they can, if the right support is given. So sometimes people with learning disabilities are able to keep their children if there is extra support. So if the grandparents are around or someone, you know, to help them. We don't have many of these facilities where they can be helped. There's, you know, live-in parenting groups or classes and things. Ideally that would be fantastic, but I don't think we have many of that. We do have some training in some parts of London. Mate crime is another big thing in the learning disability population. So people that get to become their mates and then, you know, abuse them financially, sexually, physically, etc. So, and because of their lack of awareness of danger, that, you know, they are vulnerable and easily targeted. Seen as a failure by parents and families. So lots of even society, I'm like, you know, some people are seeing their disability is seen as a big a shame or something that's brought upon the family. I think there's lots of taboos around those areas. I think Islamically there's a lot more support. There's more education that needs to sort of come out, and people need to sort of embrace that, because there is lots of information around disabilities and how, from an Islamic point of view, how we're supposed to view and help these individuals. Also, the overprotection, which I was talking about earlier, the lack of opportunity to develop those skills. So, you know, there isn't a, you know, parents or families just accept that this person is never going to be independent, so they're not even given that opportunity to try things, you know, and that makes it harder because they just never had that chance to learn those skills. You know, the same way, say, you know, we would do, you know, if we would take our little children to shops and get them to pay for something, you know, just give them the experience so that we're teaching them. But with someone with a learning disability, parents are reluctant to do that. And yeah, that sort of sets them back, and that overprotection really doesn't help. Difficulties building relationship, including romantic relationships. Well, that's a big issue in the Bangladeshi community. There's not a lot of education around relationship building, and especially in terms of understanding sexual behavior and how relationships are going to, I'm like, lots of people, there's lots of studies done. There's a few studies actually done on Bangladeshi families and who have got their child with learning disability married. And, you know, most are not actually able to manage the complexities of a marriage or not understand those kind of relationships. So it's actually a form of abuse to get them married. And, you know, because if someone's not understanding, then why do it? Because that then exposes them to more trauma, more heartache, more abuse. Just being different, that itself is, you know, something that people are having to experience and live with and adjust to, which brings about all these problems and all these experiences. They might be, you know, several of them. Each individual may have several of them, and so you could understand why these experiences would, you know, have an impact on their mental well-being. Next slide, please. I see we've got lots of
lots of comments
questions.
actually.
Yeah.
So I think what I should say, just to make it clear, there's confusion and some people don't understand there's a difference between learning disability and mental health. You can have learning and mental health conditions. Sadly, people with learning disabilities are overlooked and the shame is attached. So they isolate the child in Bangladesh community, and we need to undertake and make changes.
Yeah. Yeah. There is mental health is for everyone, isn't it? We've all got our mental health to deal with. We can all suffer those.
The conversation that we're having on the chat is really, really interesting, and it's actually.
Yeah.
Thank you very
much.
With
statistics and stuff, we could brush over. You could, you know, people are going to get the slide so they can see that. Should we? Are there questions that we need to answer?
Hello?
Hi.
Hi. Yeah. I mean, I just wanted to add just a little bit, in sense of, yeah, I'm coming from a point where my child has special, has learning difficulties, and I've got a sibling who has got autism, and I've got many cousins who have ADHD. But what I wanted to say that if you don't, mental health is linked with special needs, because if that child or that adult is not supported and they are missed through the system, whether it's at home or society or in school, then they are more likely to end up with mental health. And that has been the case with one of my siblings, because at the time it wasn't diagnosed. And I know a lot of people have got this thing about getting a diagnosis, but if there are any parents who are thinking of going forward, I would say sometimes, as much there is a debate about getting a label or not getting a label, but if you get a label, you're doing the best for that child for later in life. Because I work with SEND parents, and a lot of them are in denial. And when you do finally get them to go and get a diagnosis, they do thank me and say, I'm so glad, because now I can see the change. Whereas I think if you are in denial, your child or anyone you know has special needs, then you're making it difficult for that individual later in life. Because I've
Yeah.
worked in schools, I've worked in higher education, and especially in higher education, university, that support is not there. We have students who come through and they want diagnosed and they get diagnosed later. And then when
I
they
think
get
that is, I think although, you know, a good point,
yeah,
I think I just need to tease them apart. So if someone is
yeah,
going to university, they don't have learning disability. They have learning difficulty, that neurodivergent conditions. So autism, ADHD, you know, that it's all falling under that umbrella.
yes,
The people,
I
yeah,
agree with you, but what I'm saying, I'm not trying to get a debate going here, but I've got a lot of experience from working in schools and higher education. But what I'm saying is that where there has been denial in families when the children were
mm,
young, and then they've seen those children suffering, because I've been working with some parents, when
yeah,
they get to university, the transitioning is challenging, as in with any transition. Every day a send child is going through a transition when they're in school from, it's
yeah,
very, you know where I'm coming from. But what I'm saying, that it does help. And what I'd advise for anyone who's listening going forward, please go and learn about, if you're going to get a diagnosis, learn about it. Because if you don't know the language and you don't know the wording, you are going to be ping-ponged from system to system. And it becomes difficult, sister.
it's not easy, like I said before.
Yeah,
Like, no, we don't have a service that is just doing the diagnosis,
yeah,
because you know, what is the point? What's the
yeah,
point of giving a label if you're not going to help someone? But I think the point that we're trying to make is that
mm.
mental health, we all have to look after our mental
Yes,
well-being.
definitely. I agree. I
And
agree with that. Mental
and
health
people
is
who
key.
have got a diagnosis of any sort, you know,
Mm,
whether it's autism, ADHD, etc., but even people, you know, who've got learning disabilities, who are much less functioning,
mm,
so they couldn't even finish school, forget about going to university, they
yeah,
also have their mental well-being is also at stake here. You know, that's at risk
yeah,
because of, you know, the experiences that they've will have, you know. If you add race, etc., in there, that it just gets messier and messier.
yeah,
And I think as people in society, if we're not all thinking about each other's mental health and well-being, you know, because it's quite easy to dismiss someone with disability. If they've got a disability and you can see them, there might be some compassion towards that. But if they've got a disability, like a learning disability, which is invisible,
mm,
um, then they're dismissed. You know,
yeah, yeah,
their mental well-being is like, you're subhuman. What have you got to complain about? You know, it's
mm,
that kind of attitude, and those, you know, you've got all the stigma of mental health
yeah,
on top of the disability stuff, on top of the race stuff, you know. So it's the layers and layers just keeps on mounting on this one individual. So you'd understand why their mental health would suffer,
yeah.
you know,
It's
and they
just
need that help. And people, like you say, you know, parents or carers need to be a bit more proactive in trying to get that help. Forget about how society is going to look at it. You know, you need to give that individual some help to understand their mental well-being, to make improvements in their mental well-being, so that they're not suffering from any sort of illness, they're not having a breakdown, they're not having then a diagnosis of a mental disorder. You know,
mm,
there's lots of prevention that can
yes,
come into place before we get to getting a diagnosis. Obviously, if a child needs a diagnosis, you know, especially with autism, there is a government legislation which actually gives some protection, that someone with autism is entitled to certain things, certain help throughout their life. You know, so it is important to get that, because otherwise, you know, once the parents are not around, and there is a time when you won't be around and your children have to sort of, you know, manage without you, how is that individual going to manage? You know, those are the big questions that we need to sort of ask as society and have these conversations. But thank you so much, for, Yasmin, for your input. It's really, really effective. Yeah.
And it's really important. I really appreciate your doing this. I know I did suggest it as well, that we should look at special needs with Shamsor on the previous workshops. But it's really key that we raise awareness, we have those difficult talks, and we do break the stigma, because special educational communities are marginalized, in many
Of course.
forums. So yeah, just wanted to add that. Thank you.
Thank you.
Shamsun, which of these, what do you want to actually present? Are these necessary?
Well, there's lots of legislations and things. It's just that, as society, we've had to have these policies, and law had to go in to protect these people. That's how, we need to sort of think about this. This is how messed up society is, that we need to sort of actually have it. You're breaking the law if you're abusing someone. Like, we need to value people. Those kind of things had to come in to change services, to change people's interactions, to change people's relationship. So it's food for thought. I think we can move on. I think there's I think, is it the next one?
This one?
Yeah, this one. Yeah. So it's like helping others. Social model of disability. I think that's too big now to cover. Go to the picture and I'll try and explain that. So, we've got a picture of someone with in a wheelchair. Yeah, just to sort of understand where things are happening. Yes, this lady is supporting him. Come on, dear, go. But how have we helped? There's a set of stairs, and he's got a wheelchair. As society, we have to sort of look at how we could make this easier for this individual without making it more stigmatizing them. I think I've got another one after that. So there is a battle between the medical model and the social model. So medical model says about disability is that the person with the impairment, the person that's got the difficulties, is the problem. So we need to fix them, give them medication, give them wheelchair, give them whatever. They're the problems, fix them. Yeah. The social model, which is what we're trying to combine, that it's not medical, it's biopsychosocial. We have to sort of look at it holistically, that actually we all have a part. The social model of disability says that the stairs are the problem. We need to put a ramp so this person in a wheelchair doesn't feel excluded. No point in having a sign saying, come on, everyone's welcome, but we haven't facilitated, we haven't helped. And I think, the work Bangladeshi Mental Health Forum is doing, we are trying to sort of bridge some of these gaps that, in knowledge. That's, I think, fundamentally what we want to do is educate the community in different areas and raise that awareness of mental health difficulties, how we can look after ourselves, and the different groups of people that are within society. Unless we can educate, the more people are aware, the more people talk about these things, that's the only way we're going to counter the stigma and come to a different understanding, a more holistic, all-encompassing understanding. I think you can watch that later.
Yeah,
Any questions? I think we are going over time, but if there's any
I think it's okay.
that...
People are staying on. See, that obviously they're interested. It's good we've got this group of participants active. I think obviously somebody's mentioned about the difference between mental health and learning disability. That there's a lack of knowledge around that.
Well, mental health is not our physical health. It's our well-being, our emotional health, our psychological health, and that we all have. whether we are the Queen of England or whether we are someone who's going to SEN school. You know, we all, as human beings, we all have a brain, we all have a mind, and it all can be affected. So mental health, we all have mental health. Sometimes there are problems in our mental well-being, so disorders can arise, illnesses can come about, and they need to be treated. But it doesn't mean just because someone's got a diagnosis of a mental health condition like depression or anxiety that there's no help or you can never overcome it. That's not true, because it's a sliding scale. It can, from time to time, the stresses that we face in life are too much for us to cope with, and we might see an impact on our mental well-being. So that's something that's everyone in society has got mental health. We have to look after our mental health, and sometimes people get unwell. Learning disability is something different. Yeah, learning disability is that there is the brain hasn't developed completely. There is difficulties in the intellect, there's difficulties in the functioning, social functioning, the adaptive functioning, and it started from childhood. So that's it's different. It's quite it's not connected, other than people with learning disabilities also have their mental well-being. We have to think about their mental well-being as well. We can't just exclude them from society. You know, they're just as important. That's what I'm saying.
I think what they're trying to get across is that this is what we need to raise awareness of in the community. There's a lack of awareness around that.
Yeah.
But this is the key challenge, the key barrier, really.
We haven't had, I've been doing this for a while, but we just haven't had the chance of, you know, covering learning disabilities before. Although, yeah, but there's so much more to cover. You know, there's a huge population on autism. That's also important for people to understand what it is, how it's affecting, and how vast it is. You know, it's not something that you could easily understand. The other neurodivergent conditions are also important to learn about, as well as learning about mental health diagnosis. But there's other things that are happening in society, and we need to be sort of aware of it, be active.
There's a question.
Do you think that families need to grieve? Sorry, I didn't get that. Hold on, let me just open this up. Where are we?
Oh. It's from Dawood.
Read it out, I can't see it.
It says, do you think that families need to grieve for the life they imagined they would have when
Absolutely.
having children once they realize their child has additional needs?
Absolutely. Absolutely. As parents, you know, as soon as you find out that you've got a child, you're hopeful. You know, you're thinking of, you know, this perfect child, and you know, because you don't think about the negative. You want to be hopeful, and you want your child to be absolutely perfect. So with any conditions, you know, there's a sadness there, and if you've got a sadness, then yes, people do need to sort of come to acceptance, and accepting that is difficult. It's not something that can happen overnight, and there is a grieving process that has to happen. You know, what if my child didn't have this? But you know, when you sort of think about it and, you know, reflect on what's happening, this kind of tragedy, if it's a tragedy, can happen at any time in your life. You could be involved in an accident and you could have broken your leg, or, you know, had a brain injury. Those eventualities, I think, you know, we can't grieve for continuously, but that if it's the same, say, when someone has a miscarriage, yeah, you still grieve that child that would have been, and there has to come an acceptance to, you know, okay, you've had a miscarriage. So it's something similar. We have hopes and dreams for our children, and when that child has some sort of limitations, as parents, it's quite natural to blame ourselves. We look to blame ourselves. Maybe if I didn't do this, then maybe my child wouldn't have had have this condition. There is a lot of blame, and that's where us as society can come in and support the parents, the family of an individual who has these conditions, because as human beings, we know that it wasn't up to the parents. They didn't do anything wrong. They didn't purposely do something to have their child affected. It happened. And like everyone else, no one, I think, no parent sort of goes out to think, okay, I want to have disabled children. No, it happens. And if it does, then you adjust your life and you learn to accept it and live with that. So that's a lot of strength that needs to come. And I think as individuals, that's where we come in as a society to help people with that transition, with this movement, which is quite slow. And for some people, it might be repeatedly. You're seeing other children that are married and having grandchildren, and there is a sense of loss that my child is never going to be married and have a child, etc. So it's human nature to have that grieving.
I think you're thinking of, I think there's some comments saying that obviously to raise awareness of this, and it's an important issue, but somebody like yourself should go on TV channels. We're hoping not to go on Reality with Mahi, to be honest with you, because we're really
and believe me, I am not going to. I'm like, learning disabilities for me is I've been working in learning disabilities for a long time. 2000, yeah. So it's a long time, and I still feel the passion. I love it. I love this work. It's so rewarding. It's so rewarding to be able to help someone in whatever means possible, whether it is just listening to the family, whether it's getting the right support for the family, for individual. it is rewarding. Yes, it's a small part of the population, but that doesn't matter. It's one life. If you can make a difference to one person, I think that's achieved. That's success. For me, that's absolutely successful.
So my challenge is actually, I'm going to try to do my best to make that happen, hopefully. And hopefully we'll go on TV soon and do it in Selected in Bengali.
It's a huge topic.
And I will let you know when we do this, because obviously I'll do my best in the next 5-6 months to make it happen.
Inshallah.
Inshallah, that's right. So I've got another question here. Do you want to read it out, or do you want to say it? Is anybody out there?
Any more questions?
Any more questions before we move on? You can just unmute and just say what you need to say. Yeah, it's difficult, isn't it? Yeah, daytime.
It is difficult.
Yeah. So that's fine then. What we can do, obviously, if you have any questions, you can let me know, and I can obviously forward to Shamsunov and get a response. But just before we move on, obviously, we'll just let you know a few things that we're doing in the coming weeks. And there's a brother called Dawood who's going to tell about a bit of work that he's been doing for a few minutes. If you could just stay on for maybe about 4 or 5 minutes, that'd be great. But we've got a workshop next week on supporting young people's well-being. So it's next Thursday, on the 18th of March at 11 a.m. On the 24th of March, we've got one on managing worry. That's got practical tips and on how to manage worry. That's quite actually a very interesting one to be honest with you. In Ramadan, we're focusing more on, I think, Islam and mental well-being. So we've got somebody that's come on this forum that's actually hoping to do a workshop for us on the 14th of April. And we'll have, it's quite relevant to Ramadan. Something that we don't talk about is eating disorder. But we thought we might do in Ramadan because it's obviously a time when we're not eating, so it makes sense. So that's the 29th of April. You will get leaflets for this sent to you, and we will promote this to you if I have your email address. So please do forward it to me. So that's what we've got. So I'll email you this. I'll email you the slide that Shamsinafa presented today if you want it. I'll give Brother Dawood an opportunity to say about his work. Brother Dawood, do you want to say something, please?
Assalamu alaikum. Yeah, I just wanted to Jazakallah khair for allowing me to have a little bit of time on this meeting. It's been fascinating listening to the presentation and reading the comments, so it's been great. Yeah, we are based in Tower Hamlets. Rather than go through too much about what we do, at the moment we are working with public health and the local authority to help with key messages. The key messages around health and well-being and how those messages go out from public health to people that need to know them. We're specifically focusing on learning difficulties and disabilities. So adults primarily, but also families. The idea is we want people to tell us what messages they get around health, what messages they need around health, and also what kind of format they want those messages to be in. Absolutely happy to work with people. I've got a questionnaire that I'd like to go through with families or organisations. Just get in touch with me and that'll be fantastic.
Brother Dad, can you just leave your email address on there, please? So if anybody's interested, they take it off from there. But also, I will forward your, the information that you sent to me to anybody that's interested from here.
Yeah, if you could share that out, brother, that'd be great. So I've got that little blurb that I sent out just to give people a better idea about what we're trying to do. Basically, we want to help make sure that people get the right information about health, not just about COVID, but also in the future, post-COVID, in terms of key messages and information that you need to know to support your children.
Are you doing this in different languages or just?
To be honest with you, at the moment, I haven't. I've been asking organisations like BPCA and APASON about doing things in different languages, but at the moment that hasn't been a need. But if someone needs that, then I'd be happy to work with someone on that.
I think that one of the things that's come up here, because obviously in terms of raising awareness, I mean, what I found is nowadays, things like YouTube videos in our language makes a huge difference, say, compared to a leaflet. Because a lot of people are accessing it. And I think that, I don't know if there's obviously resources that we need to share with others, but resources like that would be helpful with key messages. Yes.
Yeah. So what we're doing is we're going to create a very simple health message and send it out to people and see what happens and how that message is received. So if someone would like to help us with producing it in, for example, with Bengali, that would be awesome. We'd really go up for that. We want it to be a co-productive piece of work, get as many people involved as possible.
So now that you're introduced to Sister Shamsun here. She is a very good Sylheti speaking and Bengali speaking. You have a good contact. I think if you want to engage with her to support you with this, I'm sure she'll be happy to do that. Shamsun?
Yeah, I think previously, when I was working in Tower Hamlets, we used to do, so myself and another psychologist, I wasn't a psychologist then, we designed leaflets that were actually verbal. So we had recordings of Sylheti speech. Well, it was all translated into Sylheti and we recorded leaflets. So information, I don't know what happened. I'm like, yeah, that was years ago, but yeah, similarly, I think there's lots of information that can go out there. And I do like the YouTube ideas because you can get all sorts of stuff there. So at least if it's kosher, then that's good, isn't it? If it's all been checked out and not just random information.
What people have said, they want up-to-date information, for example, around getting the vaccine. So when information changes, they need that information to be updated quickly. But also what they want is they don't want too much information. Some families have said there's just been way too much coming their way and they can't sift through what's the most important thing. So we're looking at targeting messages at people with learning difficulties and disabilities so that they understand it and families can then help them support them. But what we're finding as well, that sometimes the families, if they don't understand the message, it's not getting passed on to the person who needs to know what to do. For example, about when to have a vaccine or how to be safe when they go out. So yeah, if we can have something, anyone that can help us do that in a language that would help other people understand. We want to keep it really simple as well.
Yeah.
So,
I don't want people having to edit it and say, "Oh, I need to take this bit out of that," but I just want.
No, but if you're thinking like sort of easy read, just COVID information or vaccine information, just just cutting it down to the main bits. What you have to do. What's the key information? I think that would be good, and supported with pictures and etc. That would be. That
Sometimes
would be really
the easy read is there's a lot of pages.
I know.
There's a lot of info in there, so we're trying to keep it. At the moment, it seems like people are worried about how to be safe when they start to go out and about again, like even just getting on the bus or stuff like that. So we're maybe going to concentrate on that as our sample message. But we want to
your focus is your focus currently is on COVID-19 and learning disability, right?
Yeah, I mean, that's the big issue, isn't it, now? But what we want to do is to set up a process and a template where all different messages around health can be just added to it and sent out, and everybody just can understand it easily. So that's what we're trying to think long term as well. But at the moment, obviously, COVID's the big thing, isn't it? It's and quite rightly so, because there's a lot of issues and concerns.
And so thank you very much, brother. I think moving forward, Shamsina, I think there is a great demand in our community in relation to in our own language.
Yeah.
And this might not be the forum because obviously it's quite difficult to get everybody on board. So I think maybe as an organization, maybe we should think about just doing a video like yourself in Sileti that we could do.
Just record it and upload it.
Not too long, maybe 10 minutes. In Sileti covering the key points that maybe we could put out there soon at some point and people can utilize that as well. I think that would be a good idea.
Sure.
Yeah. And if everybody's happy with that, has anybody else got any questions? So what I'll do, brother, I'll pass your information on to anybody that's attended today. And hopefully they'll give me any feedback. Has anybody got any questions before we close today? You want to say anything?
I'll take it as a no.
Okay, so what I would like to do is obviously thank everybody for attending today. I mean, we've had a very interactive chat today. Obviously, we've had 99 messages, by the way, on the chat.
Wow.
So that's amazing, obviously, and it's been nice that we've had a group that actually quite passionate about this subject. And I think it's important that obviously, if you want to work with us and support us, we're happy to support you in terms of doing things for the community. So hopefully, stay in touch. Let me know how we can support you. So we will finish off this workshop at this right moment. And I would like to thank everybody for attending today. And we hopefully will see you soon. Shamsun, if you want to say anything before we go?
No, I just want to add thank you for staying. It's been quite long, but thank you, and thank you so much for participating. It's nice to see the interest and people's involvement. Yeah.
I'm going to stop this video now.
Stop recording.